Hi, I'm Alicia.
And I'm Robin, and you're listening to Bowel Moments,
the podcast sharing real talk about the realities of IBD. Served on the rocks. This week, we had the absolute joy of talking to Wendy K. We talked to Wendy about her complicated case of Crohn's disease and her process of going from diagnosis through all of the treatments and eventually ending up with an ostomy. We talked to her about learning how to care for her ostomy through Instagram influencers. We talked to her about her love of her Barbie butt. We talked to her about being pregnant and carrying her twins, and we talked to her about many things in her relationship and, frankly, a little bit of Kardashians. Cheers.
Hi, everybody. Welcome to the show. This is Robin.
Hey, guys. This is Alicia, and we are absolutely delighted to be joined by Wendy K. Wendy, I'm so excited to have you on the show because you have such an interesting, is maybe the wrong word to use, story. So we're really excited for you to share it. But
first,
we're going to ask you, what are you drinking?
I am drinking Chardonnay. It is my favorite drink. It's a Rombauer Chardonnay. I broke out the best stuff for you gals.
Thank you. I was going to ask what brand, because, you know, I am a limited Chardonnay drinker. It's not my favorite, but I do like a good recommendation. They're starting to make them less oaky, and so I like them better now. So good recommendation.
This is unoaked. I don't really know what that means, but yeah, I get it.
So, I might actually like that. Yes, I only drink Chardonnay if it's the only option.
Yes. Clearly, we need to try this one, Robin.
Yes, we do.
Robin, what are you drinking?
I am drinking a concoction tonight. I have these little not a freezy pop, but like little freezy cups in my freezer. They're black cherry. And so I use that as like my ice. So I dropped this black cherry freezy pop into lemonade and vodka. And so I have this big chunk of cherry ice basically in my drink, and it is melting and making it like a cherry lemonade. It's so good.
Oh, that sounds delicious. Now you need to name it something though, like Propofol Dreams or something.
Oh, yes.
Since we were just talking about Propofol.
Love it. Alicia, what are you drinking?
I'm drinking a cocktail called Ward 8. Look at how beautiful this is.
It's very pretty.
It's supposed to have rye whiskey in it. I didn't have rye, so I just used whiskey. Hopefully that's not too bad. And then it's got some grenadine and orange juice and lemon juice. So I've not tried it yet. I haven't even taken a sip from it, but I'm very excited because it's just so pretty and pink. So cheers, guys. Welcome to the show, Wendy. So next question for you is, tell us your IBD story.
Okay. So I had all the signs for a while before I was officially diagnosed. Raging canker sores, like where I would just have to sip on smoothies sometimes. They would be like, I could not talk sometimes. And I would have bouts of psoriasis. Like my head would be covered in like that plaque psoriasis for years. And I was always like, and it was just something about me. Oh, she always gets canker sores. Oh, she gets these weird flaky things on her skin, and never thought much of it. And had that kind of stuff, always kind of had tummy issues, but a lot of people, doctors and just people in general would say, you're just nervous. Calm down, so that's what I went with. And then got married, and like that first year of marriage, when I was a newlywed, the party started. Like could not stay out of the bathroom. It was all blood, lost a ton of weight. Like what is going on? Right. And like soon after our first wedding anniversary, I finally was like, so you go to your primary care doctor and same thing. Look, I think you're just nervous. Look, you need to calm down. And I'm like, there's blood. Like, what? Obviously, I did not calm down. I was not just nervous. And I finally, it takes forever. I finally got into a GI doctor, and he's like, I think it sounds like you have ulcerative colitis. They did a colonoscopy, and he determined, yes, you have ulcerative colitis, but I was super sick. Was in the hospital for it. Was in the hospital for like a month on IV steroids and stuff because it was bad. But then kind of got better. And then I stayed on high dose prednisone and Asacol. And the only thing that resulted from that was big old moon face and swollen abdomen and feeling miserable because nothing was getting better. And like, I was on like all those prednisone side effects. I had moon face. I didn't even look like myself. It was awful. So then they were like, you need to go see a surgeon. You can get a J pouch and it's going to cure you. Like they even use those words, like it's going to cure you. And, I consider myself a knowledgeable patient. So I'm reading all this stuff. And this was back in 2005. So what, like 17 years ago, almost 18 years ago. So it was way different back then. And so I'm like, yeah, by all means, I'm 25, 26. Like I have a whole life ahead of me. Let's do this. Let's get this J pouch. So I did. It was like a 2-step process at the time. So they had a temporary ostomy just for a few months, and then they reversed it. And it was pretty much immediate right after the second surgery where they reversed. I had my J pouch. I'm all connected, hooked up. oh my God, I only thought things were bad earlier. My body just freaked out. Oh my God. And so I got the worst arthritis, like could not walk. And it just happened so quick. And then I go back and see my surgeon and they're like, oh, you probably have Crohn's. We took the large intestine out. Now it's going to get angry somewhere else. So the IBD arthritis that I had was so bad that I was in a wheelchair. I could not walk. I had trouble like holding my head up. It was the darkest point. And then my body just shut, it just freaked out. I'm a little person anyway, like not a little person, but 5'2", super petite. And I got down to 65 pounds and it was just a bad time. It was really dark. I just picture that time of like, how was that? I was like, everything is just black. It's just dark. I don't know. It was bad. Then I found a rheumatologist of all doctors that was like, you know what? There's this thing called Remicade and I'm going to put this diagnosis down and we're going to get you on Remicade and we're going to do this. And so I was like, okay. And sure enough, Remicade is what got me into such a good place. However, I'm allergic to Remicade. We learned that the first dose I got, it was like magic. I had the dose and the next day I was walking and I hadn't walked in months. I was like, oh my God, this is a miracle drug. So I go back in for my second one and like 2 seconds into the drip, I like have trouble breathing. My whole body starts getting hives. I start throwing up. Like it was instant. And I was like, oh my God, something's wrong. And they're like, oh, you're allergic to it. But it was the only thing that would work. And so my rheumatologist was amazing. And so it would be an all day event. Remicade is kind of long anyway, but this was an all day event. And they would like pre-medicate me with Benadryl and all kinds of stuff. And then they'd start the drip. And then once I started getting those, like I'd still throw up every time. I'd still get the hives. I'd still get that stuff, but it would only last like a few minutes because then they'd Solu-Medrol me and Benadryl me even more. And I would just like go to sleep for the rest of the day, but they'd get it in me. And over time, it got me to a really great place. So things are good, but I say in a really great place. But around this time, I started developing a pouch vaginal fistula. So gross, so painful, so weird. I don't want to talk about it too much because, so other symptoms are kind of starting to brew, but I can walk. I'm normal weight again. I get my body to a good place because I really wanted to be a mom and I really wanted to try to have our own biological children. So luckily I had fantastic doctors that were like, okay, let's see what we can do. And so I had like a 6-month window that they were going to give me where I was only on prednisone. And I had to go through IVF and a couple failed attempts of IUI where they determined like I had enough scar tissue in me. That was my built-in birth control. So they just went straight to the source. They kind of went in and exploratory and they're like, oh my gosh, you have all this scar tissue here. Nothing was getting through. So they kind of like burned off an area and like made a little spot and they're like, here's where we're going to go. And they put 2 in and 2 took, and I guess it was meant to be. And so I was pregnant with twins, and the pregnancy, people say they get better or worse. I just stayed the same. I didn't get worse, but I didn't like have this magical, like, oh my God, I feel amazing. So it was fine. And so they took them like a month early. With my J pouch, they didn't want me to go into labor whatsoever, risk being incontinent. So they took them out early. But once again, and I was kind of warned like, hey, your bodies might not like this. And it definitely did not. They went down the same, like long, from your belly button down, they went down that same scar to pull the babies out. And they kind of told me what happened was like, I don't remember a lot. And I ended up like, I lost a lot of blood. And I just kind of remember seeing spots and I was out of it. And next thing I woke up like a day later and hadn't held my babies yet. And I was getting blood transfusion. So they were like, that was great. Don't ever attempt this ever again. You can never do this ever again. I was like, okay. So my body freaked out again. It took my scar over a year to heal. So I had this gaping open wound for like a year, and I had twins, and their first year is a blur, but I have fond memories, but it was a blur and I don't ever really want to revisit that again. My body was bad again with IBD, and I have this scar, this wound that won't heal. So that happened. And I have to say that ever since that happened, I was never really in remission, but I was in a good enough place to try this. But ever since that, my body has not been good since. The IBD, everything just kind of went whack after that, big time. So over the years, this pouch vaginal fistula would only get worse. Tried all the biologics because they were like, okay, we're not going to keep making you go through Remicade. You're throwing it up we're not going to make you go through this every time. So tried all these biologics, kind of was keeping me afloat. I've never not been on prednisone. So just this past few months, I have switched over. And so my adrenal glands are dead. So I will have to be on some form of, now it's hydrocortisone for the rest of my life. And that's a whole other thing. But I guess prednisone kept me afloat and let me able to be pregnant and, be a mom, which is what I always wanted to be. So there's that. Prednisone's your best friend and your worst enemy. But throughout the years, I had a lot of narrowing going on that they'd have to kind of go in and fix. I had an obstruction that resulted in an emergency resection surgery with wounds that would never heal, constant pouchitis. Then I'd have procedures to put a ceton in for the fistula, and it was constant. My life revolved around that. But I just wanted to be a mom and, my kids. But IBD kind of takes over. A few years ago, my doctor, we had a colonoscopy, all these issues. The fistula is not getting any better whatsoever. It's y'all, a pouch vaginal fistula, it's as horrible as it sounds. Like you have shit coming out of like your lady parts and you have to there's no spontaneous sex going on. Like you have to plan this out. I got to get cleaned up. I got to, let me drink my wine. Let me get good feeling. Let's clean up. Okay, we have this window. Okay, let's go. So just and then I'm always wearing a big bulky overnight pad everywhere. Constantly having to change it out during the day, a lot of pain associated with it. I'd get UTIs like crazy. It was awful. It was a horrible way to live, but it was the only way I knew how to live. And I'm a control freak. So it's kind of like, but I know what to do. I know how to handle this. So just let me be with this. I'll just deal. I think a lot of patients just say, I'll just deal with it. I can deal with it. I got this. I'll just deal with this. So that's what I did. But my doctor was like, you know what? There's nothing more medically I can do. It's time for an ostomy. We got to disconnect you from this J pouch. It's causing you too many problems. So that was really hard for me mentally to come to grips with. I went to therapy to talk about it. I was like, hold on. And my surgeon she's amazing. I have no words for how amazing she is. And even she couldn't fully convince me. And she was so patient with me, but I just couldn't mentally get there. And I have control issues. And it was just, this is something out of my control at this point. I mean, let's be honest, everything has been out of my control at this point, or so I thought. And it's a body image thing. I didn't worry what my husband would think. I didn't even worry what my friends or family would think. It was me seeing it in the shower or seeing it when I change. And for some reason, I could not get there mentally. But then I just felt so horrible that finally I came around to it. So, and my surgeon was great. And she's like, look, we don't have to take the pouch, we can just disconnect you. The pouch will stay in. And then if you decide I can't deal with the ileostomy, we'll reconnect you and you can live this horrible life again. I'm like, okay, sounds good. So that's what we did. So I got the ileostomy, which I consider permanent, but always knew in the back of my mind, but I can be disconnected and wear overnight pads all the time again if I really want to. So a few months into that, things were great for a while until they weren't. And I started seeing a lot of IBD patients who don't have all of their insides, what you eat comes out looking like it did going in, right? So suddenly I'm not supposed to go, I have an ostomy, I'm completely disconnected, but you kind of go to the bathroom and sometimes mucus will come out and that's normal. And this was way more than mucus. And one day I look, I'm like, okay, well, that's a blueberry. Okay, well, that's part of the tomato I just had. That should not, how is this happening? And then it just got really bad. And I still have the pouch vaginal fistula issues all of a sudden again, never really got fully better. And it just got worse all again. So I'm like, I don't know if this is normal. So I'm calling my surgeon and so here's what's happening. And they're like, oh, let's see what's going on. Lots of scopes and things later. And they found where my J pouch had formed another fistula kind of up into my small intestine before it would get to my ostomy. So they're like, we got to take the J pouch out. And I'm like,
wait, stop for a second. So your J pouch reconnected itself?
It just kind of wiggled and wormed its way and formed another fistula up into my small intestine. It just I'm totally disconnected from it, right? So how is this happening? Why is stuff coming out of my butt? And why is everything so now I'm having stuff out of my ostomy, my asshole, and my vagina. And I'm like, what is happening again? This wasn't supposed to happen. And so that they had to do a lot of scopes to find the behavior of it. Do you know what I mean? How is this boring into your small intestine and where? And did you know that you can get an internal tattoo? I have one because they were trying to pinpoint things. And so one time they went in and this doctor was great. And that was one of the times where they were telling me quit telling us how to do our job, give her more stuff, knock her out so we can do our job. Because I was then I kind of got loopy because they give me stuff before. So I'll shut the F up and let them do their job. And I was like, so the tattoo you're going to put, can you make it say mom, or can it be a heart or flowers? And he's like, I think, okay, let's go to sleep now. But so they kind of tattooed, like, so I had all these tattoos, like, okay, here's kind of the area of it. So learned all kinds of stuff, but yes. So they found where another fistula had formed. And so they're like, okay, we got to take this entire J pouch out. It is the devil inside of you. Right. And that's a huge surgery. So, and there was a lot of surgeons involved. My surgeon, and then she had like 2 others, and a plastic surgeon was big time involved. And so it was like a 10, 11-hour surgery, I guess. But like your J pouch is connected to so much down there. So it's a real tedious, how they describe it, is a real tedious surgery, like a lot of little cutting, and you have to do it just right because it's connected to so many things down there in in that cavity down there. And so they removed the J pouch. They resected the small intestine where the fistula had formed. And then they found another fistula forming that they hadn't, like, starting to form from the pouch again on another side of the small intestine. So they resected that, which they didn't know about until they got in there. I had a pelvic floor reconstruction because they took it out. And so now there's this like space to fill, I guess. And they also kind of reconstructed my vaginal wall where the pouch vaginal fistula was. So I had all kinds of stuff done. And the best part is I got a Barbie butt, which is a way prettier way of saying they sewed my anus shut. They call it a Barbie butt because it's like, like Barbie dolls, like it resembles a Barbie doll or a Ken doll for men, but nothing comes out. So I like to call it that way more than using the word anus. So, but they had to like literally sew my butt shut, like my asshole was sewn shut permanently. So it's so weird. And then they kind of redid my ostomy while they were in there, and it's super pretty. She's amazing. And so, yeah, that was 6 months ago that they did that. Of course, it wouldn't be me if I didn't have a complication. Like I was in the hospital a week and then I got home and I just kind of knew because, obstructions come on so suddenly. And I was like, here we go. And so I had an obstruction, went back in. That's a whole nother story. I was begging for the NG tube. I was in so much pain and throwing up. And so, with all the PTS that goes with NG tubes that I've had all the time, I was begging for one. So you knew it was bad. A couple of days later, they were like, well, maybe it's part of the ostomy. I don't know. So they had to kind of go in and search where it was. And like, it was just swollen and my small intestine had kinked up and, obstructed itself. And so they had to resect it again. And this was just like 10 days after the first surgery. So, but all's been good since then. So I'm just kind of adjusting to that. But I love my Barbie butt. I love my even prettier formed ostomy. And I'm just hopeful that I can stay out of the hospital for a while now. And like, I don't know what I'm going to do with my life now that it doesn't, I'm sure stuff will come up again, and stuff can always, I still am on my Entyvio. I'm still on my Stelara. I still do that, because fistulas can form, Crohn's disease can show up anywhere in the body. So we'll just hope that these things keep it at bay and they got rid of the stuff that was, causing the worst of the symptoms.
I feel confident just in the way that you told your story that you will find something to do with all of your free time now, that you're not like actively managing your IBD moment by moment. There are so many things that I want to ask you about that are probably not even included on the bio that you sent us on the questionnaire.
Were you like, I'm going to try to condense my story or I'll just talk a whole bunch.
No, this was good. I am going to go back to the arthritis that you got, because I have talked about this a little bit on the show, having the joint pain. And I have had joint pain for a while, but after the J pouch surgery, like it has been exponentially worse. Now I'm not in a wheelchair. I can still get around, but now that listening to you share your story, I'm like, oh, this makes so much more sense for for me, it makes so much more sense.
It is real. It is a thing. It is, It is just as debilitating, if not more than, all the bathroom symptoms.
Yes. Agreed. 100%. It's like a constant ache that doesn't go away and then it gets worse.
And I was like a 90-year-old. It was awful.
Yes.
We lived on a second floor apartment at the time. Matt was literally carrying me over the threshold like every day. It was, oh God, it was like the lowest point in my life. Anyway.
When you had your ostomy, when they disconnected it from the J pouch, did they give you a loop or an end?
An end.
They did give you an end.
Mm-hmm. I mean, let's be honest. She was probably like, this girl's not like, and then, both times, like the first time around when I was just disconnected. And then this past time around, I was like, oh my God, I said to my surgeon, I said, don't you want to say I told you so? And just like yell that in my face. She's like, no, she's so sweet. She's like, no, you just had to come around on your own time. I'm like, I should have done this like 5 years ago, 10 years ago. Like, oh my gosh, I needed to get over myself and just do this. But she was
You don't know. You don't know what you don't know.
She was so sweet. And she was like, it's okay. You're a mom. And that's just, you had to consider all of that, and you're a mom. And that's just what we do sometimes. We don't put ourselves first. And I was like, oh my God, I love you.
Sweet of her to coach
Will you
it that way.
yell at me and say, I told you so, I deserve it.
Can I ask some remedial questions for both of you? Because both of you have had ostomies, and there's a couple of things I want to clarify. When you have an ostomy, do they scope your ostomy? Like,
yes, I've had that time.
Explain this to me.
I was awake because they were trying to figure out like, where is this fistula? And so I was awake, and they would just like, here's the scope. And they just like put it in, and it was so weird. I was like, and I can handle a lot. Like, I don't get squeamish or grossed out, but I was just like, can you knock me out next time? But yeah, they just stick it down. And I mean, they didn't go very far, but in a few months I'm having an ileoscopy, and I don't know the details, but all I know is I don't have to drink that shit anymore. I don't have to drink that horrible stuff. And I'm like, okay, all of this was worth something. But so I don't know if am I awake the whole time? I don't really know, because they're going to go a little more. So I guess I'll find out. But yes, you can.
I would advocate for like not being awake. I feel like just because, that would be really weird to watch them put anything in. Is just
anyone who knows me at this point be like, no, really, you need to knock that girl out. She's going to drive you crazy.
You're like, I'd like to see the camera. Let me give you some pointers. You know a lot at this point. You could be very helpful potentially. Okay. The other thing I want to ask you, again, remedial question probably for both of you, but like, okay, Barbie butt. You say you love it. I am a little mystified still as to exactly why do you need to have it sewn shut? That's
a good question. I guess I don't know technically. I guess because there's nothing, like it's just a empty cavity. And so you don't want anything to like fall out. I don't know. I need to ask them. That's a good question. I just went with it. Like, okay, sounds great. Let's do it. I need to ask for more technical stuff.
Well, no, they have to sew it shut because it is an open cavity, but there's like, so if there's part of your rectum left in there, right, they sew that from the inside, right? And so there's still mucus and anything that could form. And so they have to,
and I didn't have
get it sewn.
When I very first had my J pouch out, they took my rectum. So I was just like J pouch to anus.
That's how I am too. J pouch to anus. Yes.
Well, yeah, it's just, like, and then I guess just to keep things, intact.
I mean, I suppose you don't want stuff like floating around.
And I had a lot of like fissures and like open sores on my butt, like along my butthole and stuff, because it was just so angry and so infected, like just so angry and diseased. And so I don't know, keep stuff away, I guess, like stay away from that area from now on.
So I am curious, you mentioned they reconstructed your vaginal wall and that there was a plastic surgeon there.
Yes.
Explain to me what the plastic surgeon was doing there. I mean, did like maybe you get a little lift here and there too? Maybe throw in
I was like, can you give me like a mommy makeover while you're at it? But no, that was new to me when she's saying, okay, we'll have this team, we'll have this person, and then so-and-so will be your plastic surgeon. And I'm like, huh? Like, why? And so she's like, well, she explained it, but I'm still just like, I'm a glass half full girl. I'm like, sounds fun. Like, welcome to the party, And so I go to consult with him. Y'all, he's so hot. He's so hot. And so, but I'm waiting in the waiting room, and I just know GI offices, right? I go in this waiting room, and there are these like lovely artistic pictures of like boobs and like flawless bodies. I mean, they're like drawings. It's not like actual pictures, but I'm like, where am I? Is botched here? Is a hidden camera? Is Dr. Terry Dubois or what? You know who I'm talking about from Botch? I was like, or Janice Dickinson. If they come out, I was just so out of my realm. And so they call me back, and I'm like, okay. And I'm already pitting out because I just act a fool in doctor's offices anyway, because I have white coat syndrome really bad. And so I get back there, and they're like, okay, well, here's your gown, and here's your like panties to put on. These were not panties. It wasn't even a thong. It was like this thing I had to put on. Do y'all know what I'm talking about? And it's like a little bit of like mesh or gauze or something. It looked like a mask, like the mask you wear. It looked like that material. And it was
I know what you're talking about.
Oh my God. And it was like, put these on. It's like a little rubber band. I'm like, why am I bothering to put anything on? This is a joke. I didn't know I could sweat out of my vajayjay, but I did big time. And so, but before that, I was like, oh no, I'm just here for a consultation. I don't need to put, I'm not here for anything like that. And the girl was like, I know this is what everybody does. You can put this stuff on. He'll be here in a minute. I'm like, okay. So I'm like, how does this even work? Like, it's kind of like those things you wear when you get a bikini wax. but even less coverage. So anyway, to add to it, there are these huge floor to ceiling mirrors in there. Why? Oh my God, I could not escape myself in this thong thing. And then this robe, I'm so uncomfortable. I'm already like pitting out like crazy out of every like orifice of my body. And so I don't know what he looks like yet, but then he walks in and I was like, oh shit, of course he is just the most handsome guy ever, making matters worse. So he gets in and, okay, here's what we're going to do. Tell me a little bit about stuff though, your surgical history. He kind of gets the lowdown and I am all over the place. And I think about 10 times, I like do this weird, I like put my pointer finger up in the air and then I point to the top of my head and I'm like, I know, Hot Mess Express. I know that's a phrase that people say, but who says that like 10 times in a 5-minute period?
I can't.
And he'd be like, oh, so it looks like you didn't really heal. The scar that took me over a year to heal. He's like, oh, it looks like you didn't really heal well. What happened there? So I'd explain, well, the J-pouch surgery. And then they opened up and took my babies out, and it took me over a year to heal. I know, Hot Mess Express with the weird pointing. Oh my God. I couldn't stop. And then I hate awkward silences. And it wasn't awkward. I was the one making it awkward. And so I just kept rambling about God knows what. I think I talked about how much I was pitting out. I think I asked if Botched was there. Like, am I a Botched? And oh my God. And so, but then he has to look at things down there. I mean, we're all used to embarrassing stuff at GI doctors and appointment, everything rolls on our butt. So it's fine, but it was different this time around. And he's like looking at my vagina area and my butthole and feeling it. Oh my gosh. And then these mirrors everywhere. And I said, at one point I was like, I think I went like this because I was getting all hot and bothered. And like, one, because he was hot, and two, just because of the situation. And I was like getting all red and sweaty. And I was like, y'all, I can't with these mirrors. All I see is myself. And this is really weird. And so like the sweet nurse assistant comes and like stands right in front of me to like block me from the mirror. But now she's like hovering over me. It was the worst experience ever. And he was so nice. And I was so weird. But yeah, and then at one point he was like, well, we might have to take some muscle. I need to remember what he said. I was so flustered. I barely remember any of it. They had to take something out of my thigh, maybe like, to help with reconstruction of your pelvic floor. We might have to take is it tendon, muscle? Oh my gosh. Somebody's going to correct me. Somebody's probably shouting out what the real answer is, but they were like, he's like, which thigh do you prefer? And he made me like stand, like how you stand with your leg cocked out, like influencers do or something. He was making me stand like that. And there's this mirror. And I'm like, which thigh do you want me to use? I'm like, I don't know. Make me even. I don't know. Oh my God.
You're like, this is your job, not mine.
Oh my God. I was like, do you think it's really going to come to that? And he's like, I don't know, but
give me a good thigh gap.
Oh my God. Right. Oh, and then, talking about where all the drains are going to be and all this stuff. And I was like, okay, this plastic surgeon is way more involved than I was ever thinking it would be. So he was like he was just as much as my GI, as my colorectal surgeons, if not more. And he was amazing. So that was the first appointment. And then he was amazing. I have the best Barbie butt ever. He did so good. Apparently I have a great vaginal wall. I have a really good pelvic floor. Now he was great. And every post-op appointment after that, I literally have to lean over with my ass in the air. And he's just trying to spread my cheeks apart and looking at everything. Could not be more awkward. And I swear he gets tanner and hotter. He's Jersey Shore isn't my type, but he looked like gym tan laundry, that type. I'm usually that's not my type, but did you just tan? You look fantastic. He's awesome. You look even hotter than when I last saw you. So my husband's with me at this point, which thank God. So I shut the F up and I'm not a fool, but it'll get kind of quiet and I'm there and he's spreading my cheeks apart and I want to say, I know I'm a Hot Mess Express. And I'm looking over at Matt and he's just giving me the eyes, don't say it. He's gritting through his teeth. You don't even bite don't, Wendy. So anyway, he was fantastic. So yeah, that was the plastic surgeon. So at least for my surgery, a plastic surgeon was super involved with everything also.
It's really fascinating. Yeah. I always just assume that plastic surgeons are the ones doing all the facelifts and breast augmentation and not involved in this kind of stuff. But this must be really rewarding for them to do something else that's
is it? Spreading butts, sewing asshole shut. I don't know, but
I mean, like you said, at least you have a beautiful one. So that's,
that's right.
I mean, I never knew how, how cumbersome, doesn't even put it, wearing bulky overnight pads 24/7 was, having to plan out literally everything. And then, you still leak out and it burns and you have to just kind of brace yourself while the burn happens, and how angry my bottom was in general. Oh my God, it's amazing now. But the recovery was actually harder from that than anything else. Like I couldn't sit for like a couple months. I had to sit on like an air cushion, if at all. And then like in recovery, I had to like lay at an angle. Like I always had to lay with one butt cheek up in the air at a time while it healed. That was really hard. And then like, I still can't squat for a while. So I don't know. I'm like, but it's human nature. Like if you drop something, you squat down to get it, but you'll kind of feel it. And I don't feel like it's going to rip or anything like that, but you just kind of feel it. And you're like, oh, I don't want to do anything to aggravate it. So I'm, like, don't drop it like it's hot, or anything like that. And so I'm like, okay. And like riding a bike, like sitting on the bike seat, he's like, yeah, wait like a year to do that. And don't really do a lot of squats and things like that.
Are you an avid biker? Was that a concern?
No, I'm very much an indoor kind of girl. But like I have a little cruiser bike and ride on the trails here and there, but no, it was okay. But he was just thinking things. But like I love to do bar workouts, and there's squatting in that. So I have to, well, let's be honest, I modify a lot in anything because, but I definitely modify when it comes to squats. But the healing of that was really, this was definitely this one that I had in March with everything done. This was the hardest surgery. I mean, I was going to say procedure, but hardest surgeries I've ever been through and then recovered from. Also, my age isn't doing me any favors at this point, but I'm 44 and you don't recover the same as you did when you were 25 or 32,
No, you do not
Not
recover
at
the
all.
same.
No. And I think now I'm kind of experiencing, I think my body's just trying to figure stuff out again. And so, and switching over from prednisone to hydrocortisone to try to, I can't taper off, but find that right balance. And then, when your body's all healing again. So dealing with a lot of fatigue, dealing with what I think is probably a lot of absorption issues going on because, with an ileostomy, I think I'm always perpetually dehydrated. I'm constantly dehydrated as it is. So you have my electrolyte water that I try to drink, throughout the day. So I don't just chug it. But yeah, I'm dealing with the absorbing issues and figuring out like diet's always weird for all the patients, right? So, it still is, and trying to figure out what that needs to be now. So I'm a work in progress still with all of this.
Well, like you said, unfortunately, at some point, also your nutritional needs change because of your age. Like I'm facing this now, like you get into your 40s and suddenly you're like, oh, I should be eating more protein and less this. And like, so add age on top of it too. But I do think eating with an ostomy, eating with a J pouch does seem to really shift. I mean, Robin, you've experienced this in your surgical journey, which lack of a word for that, figuring out how you can eat, like introducing foods and stuff like that. So when they reconstructed your pelvic floor, did they automatically sign you up for like pelvic floor therapy? How did that work?
Not at all.
Did you just say no?
Nope. And I did not even know that was a thing until I was listening to this podcast. And now I'm like, I need a pelvic floor therapist.
You need a pelvic floor physical therapist. You do.
So good for patients. I had no idea. I know. No, I was not referred to a nutritionist, and my doctors are amazing and my surgeons are amazing. And that's why I'm kind of like, come on, y'all. No pelvic floor therapist, no nutritionist until I asked for a nutritionist recently. And now I'm like, oh, I got to ask for a pelvic floor person, right?
Yes, you do. You do have to ask for a pelvic floor physical therapist.
Yes. It probably will be life-changing.
It will definitely be life-changing.
Yeah. So I don't even know. They're probably going to be like, oh girl, we got a lot of work to do here. I don't even know what I need help in that realm.
Yes. That's exactly what the pelvic floor physical therapist said to me. Sweet tiny baby Jesus in a manger. You need some help. Like you need serious help, lady.
There's some hot mess express going on in here.
Yes.
Mm-hmm.
That's a clinical term, I think, for a pelvic floor therapist. I am absolutely shocked that wouldn't just be an automatic, like if you're rebuilding somebody's pelvic floor, like, sure. Wow.
Sure. I know.
That's really wild. Yeah. Okay. Can we talk? So you are one of the first guests we've had on that's really talked about fertility issues and their inflammatory bowel disease. So do you mind staying there and talk to us a little bit about like, is this something that you knew already? Is this something you discovered? Did your gynecologist OB-GYN work with your IBD doctor? Walk us through that process.
And I knew back when I was 26 or how old I was, when I very first had my J-pop surgery, they said, those are my questions. Like, am I going to be able to still have kids? And like, yes, but you're going to need to go through fertility. Like you can try to, but you're going to need to go through fertility. So just be prepared. I'm like, okay. And so I knew that from the get-go. So the IVF doctors, my GI doctor, and my OB all kind of, I mean, they weren't like best buds or anything, but they communicated, they all kind of knew what was going on. So that was great. And yeah, they just, the key was to get me to, well, and I was on methotrexate at the time too. So, my rheumatologist was super involved. And so they had to get me off of methotrexate, and I had to be off of it for 6 months. Like it had to get out of my system for 6 months before I could even like attempt. So that was a whole process. And so that kind of was part of the, like, okay, we were off methotrexate. I think I was still on Humira then. And then I don't really know the reasons why, but they took me off of everything except prednisone, and they upped the prednisone dose. And that's what I stayed on. And so I had like, what was like a 6-month window to get pregnant. And so, they try to be like, okay, let's try an IUI. And so we did that twice and it did not work. And then they were like, okay, we got to go IVF route. And yeah, like I said, they knew that things were blocking the IUI. So they just kind of went in, cleared a spot. They kind of burned off scar tissue, cleared a spot. And then they kind of, when they went back in to do the, my gosh, I'm blanking all the medical terminology.
Implantation? Is that the word?
Implantation. Yes. To put the guys in, they knew exactly where they were going to be. So they did that. And then, yeah, like a few weeks later, they were like, you're pregnant. And then we went in a couple weeks. And then I had ultrasounds like every week. It was awesome. Like I felt so spoiled. I know that's not normal. And so I got to know what was going on weekly. They would do blood work weekly. They would watch your progesterone level. They did all of that. And my rheumatologist was watching on my other levels. And so things were just kind of stable as far as the Crohn's stuff went. And so, and then they found 2 heartbeats, and we were like, what? They both took, like, we just wanted one to take, and they both took. And I'm pretty, like I said, I'm pretty small anyway. So we were running out of room. And so somehow they could tell at 32 weeks or something that they were born at, why am I blanking on it? They were born at 33 weeks. So at 32 weeks, they could tell they were like breathing, because I had ultrasounds all the time. They're like, oh, look, they're practicing breathing. I'm like, what? They look like little fish, like gulping. They're like, oh, we're going to take them next week. I'm like, okay. Yeah. And so they took them, and, they were 3 and 4 pounds, but I think I was probably meant to have small babies anyway, because we don't have a lot of room here. And the prednisone that I was on, it didn't seem to affect anything with them. They were just in the NICU for a couple weeks because they were so little, and they were like learning how to eat, and it was great. But I do remember, like, I just crashed after that. I just felt awful. But you're so blunt, you're this new mom and you have twins, and everything's just a blur anyway. So I guess I just kind of pushed it to the wayside, and like us IBD patients do, we just deal with it. We just move forward despite it, right? We just figure out a way, and that's what I did.
You do, and you normalize stuff. That's what we say a lot on here, is normalize it. Just makes it normal. After I had my second child, I also crashed. Like, I feel like that's when I ended up in the hospital when Bailey's first birthday. Like, she turned 1 while I was in the hospital for almost a month. So it was definitely, I know now that I had symptoms right between my 2 pregnancies. After my first pregnancy, I had a lot of symptoms. I didn't realize that that's what it was at the time. And then I got better while I was pregnant the second time. But then after I had her, it was like downhill real fast downhill.
Oh, yes, for sure. But the times I do get to talk to other patients, other girls or young women, that's such a concern. And so I love being able to tell them, look at me, like I'm a wreck and I was able to do this, not, like you'll find a way. If you really want to, it'll find a way, right? Like it is possible. Don't get your hopes down about it. It is possible. If it can happen to me, like I know I say this a lot, but I really feel like I'm one of science's biggest success stories. Like despite everything, like all this happened, but here I am. Oh, this happened again, but look, I'm okay.
Yeah. And there's so many more treatment options and medications available that women can still continue to take while they are pregnant.
I could take all the biologics in hindsight. Now we know, like
now
I didn't
know, yeah.
About prednisone. Yes,
yeah.
It's so doable.
So doable.
Mm-hmm.
I am curious though, because I would imagine being that you were medically complicated is maybe the nice way to put that. Not hot mess express pointing at yourself, but medically complicated. How did you go about finding an OB that would work with you and that understood your Crohn's disease? Like, I feel like that was probably a bit of an undertaking.
I was so lucky. She's fantastic. And she knew this pouch vaginal fistula. She knows about all of that stuff. And she knew I really wanted to try, and she was on board to help it out. And she's still my gynecologist to this day. And yeah. And she, now what's going on? Oh my gosh, now you got this. Now what? Now what do we have to deal with down there? So I have not seen her since this recent one. So I'm just going to freak next time I see her. Like, check this out. Now I am reconstructed. Now how does it look in there?
She's going to be like, this is the most beautiful butthole I've ever seen. It's so good.
Like, is Barbie in here?
That's right. That is right. That's exactly what she's going to say. I feel like you left the room and Barbie came in.
Right?
Stacy and I were just sending memes back and forth to each other for Halloween about not being anatomically correct anymore. Like, this is how we get our joy. This is our fun time. And so like, cause it's skeleton time, right? It's skeleton time. It's Halloween. It's ghouls. It's ghosts. It's skeletons. And our skeletons are not going to be anatomically correct.
Nope.
Well, hopefully your skeletons are, but like the rest of you, maybe not. I mean, they haven't taken, I mean, I did just get into a conversation with my Pilates instructor about how I think it was Kendall Jenner, maybe Kylie, got ribs removed. And so I was like, to make her waist skinnier.
I don't know.
Yeah, I think that's a Kardashian thing.
I think it's a thing. I love them, by the way.
Do you? I was like, I don't know. Their faces are going.
I want her to be my momager. I love her so much.
Oh my gosh, I am fascinated by this now, but that's a different podcast. We'll start that on a different day.
Yeah.
Yes. Because I was like, I'm kind of scared of her. She's a bit of a like, she's like,
I love her.
All right, Wendy, we're going to put you in charge of getting us in touch with them.
Okay.
It's only Chloe's the one that has migraines, and unfortunately it's a different podcast as well. So we'll work on that.
That commercial.
Well, and her nails are so long that I'm like, you're not changing your baby's diaper. Like, you can't change diapers with nails like that.
Can y'all find someone to come on the podcast who has those long, the coffin nails or like the pointer nails? Do you know what I'm talking about? And they're so long. How do they wipe?
These are questions. Anybody listening, if you have those super long nails, look at my nails.
Oh, well, I would prefer that whether I had IBD or not, but how do you, how do you wipe? How?
Send us a message.
Please.
Send us a message. Tell us how you wipe. I'm curious about this too. Inquiring minds want to know.
I mean, isn't there a Simpsons episode where he has like toilet paper on a like grabby stick? Maybe it's that.
Oh, maybe it's that. I mean, I have had long nails at one point when I was younger, but just like regular kind of long nails, not super long nails or pointy nails.
Right. Well, okay. So when I first got my ostomy again, it was in the height of the pandemic. And so I couldn't have like an ostomy nurse would even come to me. Like, we had to FaceTime. It was so weird. I was like, why bother? And, I'd had that temporary ostomy in the past, which probably was why I didn't want another one, because it was just so bad. And I knew it was temporary and whatever. And so I kind of got this, but do you know how I learned how to do all things ostomy again? Instagram influencers. And they're awesome. And I still like follow even more to this day. And they normalize things for me, and they make me feel that, oh yeah, we're totally normal here. But like these cute young 20-something girls would like change out their ostomies, and here's the products I like. And oh, here's the clothes I wear, and here's how I wear it. And these are the, here's what to do in the shower. Here's what to do. I mean, they taught me everything. Thank God for them. To my point though, some of them had those long nails. And I was like, and they'd be like putting them on like all, with the pads of their fingers. I'm like,
no,
it doesn't need to be that way, but you look good. So, okay. But
no,
but I love those. I love the Instagram influencers with the ileostomies. They are, I love them so much. I feel like they're also my best friends and they just don't know it, but they've helped so much. And other people I talk to, I'm like, I know it sounds weird, but go follow these girls on Instagram and you're going to learn all you need to know.
That's really great though, especially since it's again, a completely different demographic. It's a younger audience. It's people really being able to normalize it. And, there's campaigns like there's a certain clothing brand that I don't remember the name of, but like, they have a woman who has an ostomy as part of their like underwear models.
It's American Eagle.
American Eagle.
American Eagle.
But listen, glamorous. I don't know. I just did a shout out to her, but I love following her. She does these TikToks to all those new Beyonce songs. She is so gorgeous. And she just flaunts her ostomy and oh my gosh, I love her. She makes me feel so good about myself.
Yeah. See, I love this. I think this is really wonderful that they're just normalizing a lot of this and teaching people things on these videos,
It's so important. Yes.
It's not just people doing stupid dances in my mind.
They do some TikToks too, which I just love them. I'm 44, but sometimes I still think I just graduated from college, right? I didn't, but I feel like I did.
Oh, I entirely understand this.
My kids wanted to like do a TikTok dance. And so my son, and we're doing that Drake one. And so we did it a couple times. And then after that, he's like, yeah, okay, mom, you don't need to be in them with me anymore. And I was like, oh, like sad. You were my reason to like do them, but now, okay. like, okay, it's not cool, mom. Bye.
Your kids are also like 12, right?
10,
Yeah.
12.
I think they're kind of getting to that age though where maybe you're not as cool. I don't know. Robin, did this ever happen to you? You and your daughters have such a close relationship. I feel like they never got like, I'm embarrassed of you, mom syndrome.
Yeah, I mean, I think that I took that part of my job, embarrassing them, very seriously. And there was a time in 7th grade for one of them where I was only embarrassing in certain situations. Most of the time I was okay, but then every once in a while I got a, mom, you are embarrassing me. And then 16 was the year, for both of them, 16 was the year of the eye roll, but that was a very short amount of time. They immediately went back to it. It was just a very short amount of time.
Oh,
Yeah.
I'm already getting the eye roll. And then we went to junior high orientation, which, oh my God, the awkwardness of junior high. I do not want to even revisit that. But we were like walking through the hall, like, okay, here we are. We're getting ready to go to the gym and here's orientation. And like the cute little cheerleaders are like, we're walking through them. And just like a mom instinct, I go to like tuck his hair a little bit. My son, I have a son and a daughter. I have boy and girl twins. And so I go to like kind of zhuzh his hair a little bit. And it's just like me. It's a me, like just a habit, like what a mom does. And as I'm doing it midway, I'm like, oh shit. Oh. And he gives me this look. And he was so sweet. I mean, he could have just went off on me, and he's so sweet. He said really like muttering, he's like, mom, don't ever do that again. I was like, I know. So I know. I'm so sorry. Like midway from me doing it, I was like, oh shit, I can't do this anymore. But he's so sweet. Otherwise, he's my kid that will come to the hospital and like, Robin, I think we're like, we want to get the F out of the hospital. We'll do whatever. What do you need to see me do? I'll do it. I'm like doing miles. I'm an indoor girl. I don't walk miles on a normal day basis, but I will walk 5 miles, we're at the point where they're like, the doctor would come in or the surgeon for checkup. And they're like, so we've heard you've been walking, you need to stop. You can only do this amount a day. And I'm like, okay. But my son is the one who will come and like walk the halls with me and push my little IV pole while I walk. He's like, you want to go walk? So he's good. But I, have to quit doing these things that, he's also 12 now. So I can't, lick something and get that spot off of his face anymore or whatever.
Oh, that's sad. But also, but also what should appropriately happen when you age. But so I'm curious because you mentioned your son coming to the hospital, but you have been in and out of the hospital. You've had lots of surgeries.
Life. That's what they know of me. And they know that, sometimes mom has to go lay down. My stomach hurts. It's one of those days, or I'm burning. So they know a lot. And my daughter's like, Cameron's my daughter, and she's like the caretaker. She wants to be a vet. So she's like, loves all creatures, great and small. And so she like, when I was first learning my ostomy, she wanted to learn how to help me do it, which I thought was really sweet. So she would help me with all that. She gets like super up involved with that, where Cole's kind of like, I don't need to see it. Like, I don't need to see it that close. I'll go walk with you and push your pole and, whatever, but push your IV pole for you. But I don't need to like see that, which is fine. But she's like, gets all involved. And I think it's made them more empathetic in general, or just acceptable. They accept, what's the word I'm looking for? They're just, people have stuff and it doesn't freak them out, or, they kind of think, I think they think everybody has something maybe, I don't know. That's the impression that I get. We don't make a big deal about it. It just is what it is. And sometimes they know that I can't make it to some of their things, or I got to leave early, or, hopefully that won't happen as much now. My daughter's also like the really sensitive, sweet one at the same time. And when I was in the hospital this past time, my husband, Matt will sweet talk his way in anything. He gets, I could be like the nicest person and they'd be like, no, that's the rule. Sorry. Somehow he's sweet. I guess you couldn't come unless you were 16 or over. But, I was in the hospital for over a week. And then like when I came home, I had to like lay on a couch because I needed like support on my back because I had to lay angled, and I was like, I don't think they should be here. It's going to be weird. They were in school, and I have the best support system of family and friends. I am so spoiled, and I know that, and shout out because I have the best family and friends ever. And so they just took care of my kids. And I was like, nothing maybe. So anyway, I hadn't seen my kid in like 2 weeks. I hadn't seen them. And then I went back in, right, for my complication. I was in for a while. So Matt's like, look, she hasn't seen her kids in like weeks, and they haven't seen her. And so of course the nurses were like, sure. So they came a couple times, but every time my daughter came, she'd just lay in bed and cry with me.
Oh.
And so like after the second time I looked at him, I was like, don't bring her back. It's not good for either of us. I was like, you can bring him, not her. I was like, just don't bring anybody. I'm going to get out of here soon. Don't worry. I'm going to go walk 2 miles. I'll get out of here.
Since they were really little, when you were very, very ill, how did you talk to them about your disease? Like what's age appropriate ways that you talked to them when they were really like smaller?
filtered anything. And I think it just was talked about. It wasn't like a conversation. It was just kind of a known thing. Like, oh, mom goes to the bathroom a lot because she has Crohn's disease. Oh, Crohn's disease it affects all part of your body, but I have a lot of bottom issues and I have a lot of bathroom issues. And it was just known. Like they just knew mom, sometimes they'd be like, oh, mom, just so you know, there's a bathroom over there if you need it. They just kind of, I don't know. It was just part of their life from day one. So it was never like explanations. And they've come to like Crohn's and colitis events with us. And, so they're familiar with a lot of the community and a lot of the stuff about it. Like when they were, 3, I think 2 or 3 is when I had my, like emergency for an obstruction when I had a resection. And so I had the NG tube, all this stuff. And it was on their birthday. And so they came and we opened presents, in the hospital on their birthday. And sometimes that happens. And I don't know, they just go with it. They're great.
That's really lovely. I do agree with you. I think there is something about, having a parent with a chronic illness that just makes kids maybe a little more resilient, a little more empathetic, and just understanding and accepting. I think that that's part of it too. It's like you said, they sort of just assume everybody's got something.
That definitely describes them, I think. Mm-hmm. And that's a good thing. I hate that it has to be this way for them to be that way, but it's good. They're good kids.
Well, and frankly, everybody's got something, to be honest. So,
and I think they get that. They're like, oh, that's what mom has. Somebody else probably has something else. Or if somebody does, they're kind of like, oh, okay, so that's what you have. But can I just say thank you guys for doing this, because this is so helpful, this podcast. Seriously. I mean, I've learned so much, and I thought that, I've experienced or familiar with all these things, that I'm learning all kinds of stuff. And I just get so moved hearing patient stories, and I just can, you never stop learning, and you never stop, growing and learning. And I just love this. Thank you guys for doing this. And I just kind of feel famous being on here.
I love that for you. Thank you for saying that, because we really it's a labor of love for us. I think on one of the episodes, I don't know if Alicia cut it out or not, but she said, this is a job that we gave ourselves. We literally pay to do this.
It's doing so much good, and it's helping patients. It's just, this is wonderful. Thank you guys.
Thank you. But I have to ask you a question though. Our time has flown by today, Wendy. As always, what is the one thing that you want the IBD community to know, to take away from our conversation, or from what you've learned throughout the past 20 years of your IBD life?
Well, I'm not going to lie. It sucks to be us. I'm just going to go there. I mean, I'm a glass half full girl, but I'm also going to say it totally sucks. But what I would say is advice that I need to give myself all the time. And it's just do the best you can each day. Every day is different. How you feel one day doesn't mean you're going to feel that way the next day, whether that's good or bad. And I need to practice what I preach here, because I'm a control freak and I'm so hard on myself, more than I would ever be to anyone else. And so just do the best you can and be proud of yourself for doing the best you can each day.
I think that's such good advice, because I mean, for anybody, honestly, even for people that are not living with IBD, I certainly have days where that's a lot harder for me to give myself grace and to just continue to try hard. And so I think that's really good advice. Thank you, Wendy. This was so much fun to talk to you. Honestly, this was so much fun. Yay.
You guys, we're BFFs, right?
Absolutely. Yes. Yeah.
Yes.
I'd love it. Yeah. Wendy sent us, for those of you listening, Wendy sent us an email saying, I think we're BFFs. And I was like, absolutely, we are. So
we are.
Here's to officially being BFFs.
Cheers.
Cheers.
Hey guys, this is Wendy. If you enjoyed this episode, please rate, review, subscribe, and share with a friend. Thanks.